Did you know that women are more likely to die of heart disease than they are of breast cancer? And yet their symptoms often go undiagnosed or misdiagnosed. Or that cardiovascular research has historically been based on a male biology. And that's leaving critical knowledge gaps that impact how women are treated, diagnosed, and even believed. So, welcome back to Be the Ripple podcast. And today I'm joined by two extraordinary women who are rewriting the script on heart health, Dr. Eliza Kaplan and Professor Dr. Christina Meyer-Zürn. They're not just cardiologists, they're researchers, they're mentors, and they're teachers, and most of all, they're change makers. They are co leading the Women's Heart Health Program at the University Hospital in Basel, where they're tackling some of the most pressing and underexplored issues in cardiovascular care, from coronary microvascular dysfunction to the brain heart access, from founding national networks to mentoring the next generation. Their work is layered, it's bold, and it's so needed. So in this conversation, we'll talk about what they're building, a new model of care that really listens to the entire woman's body and will have a huge impact on the future of cardiovascular health for women. Let's get into it. Good morning, Christine and Eliza. Yay. I'm so happy to see you two again. We met earlier this year at the HBA Summit, and we had such a nice panel, such good feedback, and I'm so pleased that you agreed to be on the podcast with me today. So thanks both for being here.
Thanks
Thank
for
you,
having
Sabine,
us.
for having us here.
Yeah, I feel like we've started a journey together, so I'm excited to see where this is going to go. Christina, we'll see each other next week at another hackathon,
Yes.
also on cardiovascular. So we're just, excited about this journey. So the two of you, after our session that we had at the HBA Summit, everyone was buzzing about the two of you and the energy and what you're doing. So we're going to jump right into that. But one of the first questions that I wanted to ask you is that when did you first realize that also that women's heart health needed to have its own language and that you needed to step up and you needed to found this department that you're working in and the clinic and the research and the visibility of this topic? When did that start for both of you?
Yes, so it's been known for a while that women with heart attacks have different symptoms. That's like an old story. But we got more and more details within the last years about relevant physiologic differences in cardiovascular diseases between men and women. So the knowledge we always had was never translated in any action. And now, as we got more and more data and we saw that specialized care for women with cardiovascular diseases is already established in a lot of countries like the US, like Netherlands, where Lisa is from, or Germany, where I'm from, we realized that we also need that in our Basel area where we work at the University Hospital. Because also in clinical reality, we saw a lot of women who had complaints like cardiovascular or unspecific symptoms for a long time. And they were presenting again and again in the emergency department, in the cardiology department, and nobody really took care of them. And sometimes they also came late and had already scars in the heart and a reduction of their heart function. So we thought, okay, it's really time not to talk about sex differences anymore, but to take action to found this clinic. And we were very happy that our chief of department, Professor Felix Mahfoud, helped us establishing it and was giving us the possibility to do this and gave us the drive and all the logistics to set up this clinic. And so, yeah, we started more than a year ago, and it's crazy how many patients we see and how much we reached in this 1 year.
And maybe tell us a bit about that. That's where you are now. How did you get there? How did the two of you meet and decide we need to go on this journey together? Maybe each of you can share. Eliza, you can start. Just tell a bit about why did you decide to go into the cardiovascular care, and how did you end up where you are today?
Oh, that's a long one.
That's it.
The cardiology itself, you mean? I
Yeah.
just found it the most fascinating field. I like that it's that you do your own diagnostics, that it's rounded field, that it's one organ. That's also what I liked. And maybe it sounds silly, but also kind of out of a romantic point of view. It's the heart. I think I always thought that's the neurologist would say the brain is the most important organ, but I would say the heart is that's the engine where everything evolves around. So where most songs are written about. So I just
An endless number of
found
songs.
exactly. So Yeah, and there were different diseases that I also found extremely fascinating, like a broken heart syndrome, which happens when you have an acute amount of stress, mostly in women also, and you can, just because of a big amount of stress, you could have a disease where it looks like as if you're having a heart infarction, but you don't. It's a temporary where part of your heart muscle just doesn't function anymore, and it can be very dangerous, of course. But then if you treat it well, and if you reduce that stress trigger and you look at the heart again in a few weeks, then it looks like nothing ever happened. And that I found fascinating, that our emotions, our brain is so connected with our heart as well. So there's just so many things that I find fascinating about this topic. So yeah, that's how I got in it. And then, well, Christine and I just connected on general things, and then we started talking about the future here in Basel, and then we found out that we have the same interest and the same passion for this topic, and we thought, like, yeah, let's see if we can build something. Let's see if we can work together on this, and it's been great, I would say. Great that we could support each other in this way. And also, I really believe that we could have never reached so much in this year if we wouldn't have cooperated so well together. When I can do something, she fills it in, and vice versa. And it's very nice that you can just talk about what's your next step, how are we approaching this, and there's a lot to do. It's really nice to do this together with someone that has the same amount of drive, the same amount of positivity, and yeah, it's been great, I would say.
Yeah. Christina, what about you? What drove you or was your guiding light to come to this profession?
Yeah, so I think similar like Eliza, I always wanted to be a medical doctor when I was 3 years old. It began and then it never stopped. And I was fortunate enough to get the possibility to study medicine. And I also think like the heart is like such a central organ, and it was always fascinating me throughout the studies. And yeah, so sometimes it's also kind of like fortune or luck in which kind of environment and department you come. And I had really nice colleagues in my old university where I worked for 12 years. And there I already started to have interest into women's heart medicine. And we didn't have a specialized clinic in the beginning, but I was the one responsible also to educate the female population about cardiovascular risk, about the specialties in women. And I always had such a nice feedback from the ladies. I had the feeling I really can move something. And when I then came to Basel, I got to know Eliza. And yeah, Eliza, she was also active in this field in the Netherlands already. And then we said, okay, this is missing here. And we met every day when we had our morning rounds. And there were a lot of situations when we saw that, yeah, there's a patient. And again, it's a woman who had unspecific complaints, and she comes now with a big myocardial infarction. And then Eliza and me, we always said, okay, that's another case, and we have to do something. We have to start it. And yeah, and then we just put it into reality. And now we're really happy to offer this care to the women. And we have a lot of nice feedback, and really hope that we can make a difference.
Yeah, yeah, you definitely are. And it's interesting to hear so that you started to compare notes. So was there this moment, especially looking at the patients, was there like this final one where you're like, okay, now we need to do this? Sometimes we think about there are these aha moments and this is then what we need to do to move forward. Did you have that or was it a progression?
Yeah, so I had a moment when I already had met Elisa and we had already like drafted what we want to do. And I work a lot also in the echocardiography department. And I saw a woman, she was like in her mid 50s, and she came to ultrasound. She had a myocardial infarction. And I saw that like a significant proportion, like almost third to half of the heart was not pumping anymore, because that was the scar that resulted in that big myocardial infarction. And she told me, yeah, she was at home and she was just feeling unwell. She had like vomiting, dizziness. She was very like sleepy, tired. And then she went to her general practitioner and told him, and they thought, okay, it might be like an infection of the GI tract or like something unspecific. And then it went on and on for like 4 days, and in the end, she couldn't breathe anymore, and she was like feeling really, really bad. And then she came to that hospital in the rural area, and then they found out, okay, there's something really wrong with the heart, and she was transferred then to our university hospital. And I saw that it's really late, like the part of the heart that has not been supplied with blood was already dead. It was like a scar, and I thought, oh my God, in this time where we live now, where we have a lot of data, this should not happen. And that was really like, again, like kind of shocking for me, and also like an emotional thing to tell her, okay, see, there's like a big scar on your heart, and you will have heart failure, you will need medication. And of course, I want to give her hope, and we have good treatment for this condition, but that was kind of a turning point. And then after this, I called Eliza. I said, okay, so now is the time we have to do something. I had another woman who came so late, and I think for me, that was kind of a turning point to see this, like in 2025, to have or 2024 it was, to have a woman coming so late.
Yeah, it's shocking, isn't it? And we always, I think we had some conversations about this as well. And you hear it all the time. If it were a man, would he have been treated completely different and rushed off to the hospital? Yeah, we have the awareness piece. I think obviously the work that you're doing, but also the awareness piece is so important too. That women really hear this and they don't put themselves aside and also I don't know, devalue their symptoms that they're having, and they think I got to keep going. I have to keep moving forward, and
Yes,
so
absolutely.
such an important piece. Yeah,
Or don't recognize their own symptoms. Because in this case, I think the woman just didn't recognize it because they were not standard
yeah,
symptoms. I also think it's not unwillingness of doctor to not recognize. Every doctor wants to treat
uh-huh.
their patients as good as they can. But it is sometimes difficult if a woman has really, I would say I cannot say unusual but just complaints that you don't learn as being standard. And also for the
Yeah,
women themselves, they have to think also there's something wrong. So it's from every level, patient level and from a doctor's level.
yeah, so true. That leads me to actually two questions. So maybe I'll try to combine them into one. So tell us a bit about the clinic, Lisa. How did it start? How did you two decide to do this together? Because I think that that's an important point to talk about, to encourage also other women who could be in a similar position and say, I don't want to lead a department by myself. I want to work with someone else and push this forward. How did you decide to do this? And to your last statement about not recognizing your symptoms, do you also have educational programs as part of what you're doing?
I think if you start working together, it's very important that you, one, trust one another and that you have a
The
common
we.
ground, that we have a goal to make the lives of certain women in our area a little bit better. And if you go for that common goal, then I think that's the best way. It's not as important who does what. It's just who's on the forefront. We do this together. We are equal in this. And I think that's the most important. It's like you want the best also for each other. So if something is good for Christine, it will cost me time, I would do it, and vice versa. If that is what helps our program further. So that's one point. And I think we said from the beginning, if something bothering us, we would address it. We are very open in our communication. We can say honestly if something is not going well, and I think that's also very important, definitely for women, important to be upfront about problems and not. So that's one thing I think works very well. If you want to start, you just have to be very honest and clear in your communication. Before we started our clinical part, what we did is we looked at which players are very important for these women. So we are not just one field. So we also work together very closely with, say, the gynecologist, with the rheumatologist, with psychosomatics. So what we did was build like a group around us. When we started, before we saw the first patient, going to different departments and saying, this is we would like to cooperate. If you see this type of women, you can send us to us. We are always available for a call to discuss a patient. And that worked out really well. That cooperation also with different departments, not just looking at the heart, but looking at the woman as a whole. That's absolutely our strength. And also not just looking at the clinical part, but doing it as a full program. So we do clinics, we do research, and what you just said, your last question is we do teaching. This afternoon, I start a new program also for students to look at differences in sex and gender in cardiovascular disease. And this was because teaching is also part of our profession. And we both teach, Christine and I had the last session, I had a teaching about a man with chest pain, and it was classic risk factors, classic how it developed. First, we had chest pain with exercise, then in rest. He had diabetes and was smoking. It was a clear-cut case. And then I thought, yeah, it's not that difficult. If you would put it in as a patient in Google, you would find this too. But patients are much more complex than that. They don't all have standard classical risk factors, standard classical stories. And what they learn is exactly what I was taught 20 years ago. So even though all these changes happen for 30 years of research in this field and awareness campaigns, still we teach our students exactly the same pictures, exactly the same things as I was taught 20 years ago. And that's also why we thought, okay, we need to address this and change this also in students. We still need to learn that a man that comes in with a high risk profile and chest pain, that you have to be super careful that he doesn't have a myocardial infarction. Of course, that's the basis. You also have to teach that, but you also have to teach students to think that if a woman has a different risk profile, that you don't see her as low risk. You have to recognize that she could have different risk factors, such as diabetes during her pregnancy or autoimmune disease or extreme stress. All these things you have to take into account when you see a woman or a man in the emergency department. That's so our own experience led to develop this program. And again, in every step we do this together.
It's true. And the different perspective, because I think each of you obviously comes in with that, and that just makes like the traditional 1 + 1 = 10. What you all are doing. It's incredible. And you're right, the educational piece is so important. It really is shocking to hear that people are still being taught the same way as it was 20 years ago. Like we are like in warp speed with research and information and awareness and what's happening. And it's shocking that that's still happening. So it's so important that you're doing that and tying along with the research and the patient care with the teaching. And I think too, sometimes it's the time to do it, because looking at someone holistically can take time. And sometimes I think our systems, I don't know, in Germany, sometimes I feel like I'm pushed through. So I think that that's an important piece too, is that especially doctors take time to hear people and to look and to listen and to do that. So yay that you're doing that for all of us that are potential patients to push that thought through.
That's absolutely a really, really important part of what you're saying. And that is that most doctors are overstressed, overworked. We see a lot of patients, and you need to take time to figure history out and figure out when certain complaints started, why someone is coming, and it takes time. That's and time often that is not given. So it's not, I wouldn't say a fault. It's just we are lucky that we can spend this time with our patients to talk to them.
Absolutely. But we also like hear a lot of times like women saying, "Yeah, you're the first doctor who looked me to the eye when he or she was talking to me," because normally they did sit on the computer, have 5 minutes time, type everything, and we currently have the luxury to have very big slots where we really have time. But that's also because the women who come to our clinics sometimes are complex. They have a complex history. They've been to many doctors. They have unclear symptoms, unclear diagnosis. And so, we are lucky to have this time. And I think the time is good invested to make a thorough medical history, because then we are much faster in doing the right thing for the patient, selecting the right diagnosis, the right therapy. And also then we don't give the chance that they come back again and again and again. So we want to stop this, that patients are coming again with like different unclear symptoms. We take the time, we want to thoroughly work up the things and then give like our medications or like the things they need.
And I
And
think that saves time in the end.
yeah,
If you
It
do
does.
one
absolutely.
time very thoroughly,
Yeah.
Yes,
and I explain
exactly.
everything detailed to the patient, next time I only need, instead of a half hour, I would maybe only need 5 minutes. If the first
Yeah.
moment you need to invest time to explain what they're experiencing, what they're feeling, what
Mhm.
kind of test, what it means, and then it's easier. And it's not just, it's of course, we're lucky, but it's also, this doesn't happen if you're not supported by your own department. If your department doesn't see it, if if your chief doesn't see it as important that you invest this time in it, then there's no availability either.
Yeah.
So it's very important that if you start a program, it's also well supported by your department.
Yeah.
That's actually a good segue. Christina, how did you get the buy-in for this? How did you get the ability to set up the department when that you had the time, that you had the support? How was that journey? Was it difficult? Was it
Yeah, I think it
easy?
depends. Yeah, it depends a lot on the structures in the department and also of the people leading the departments. If they see that there's an unmet need for the women, and in our case, our boss was supporting us right away. He knew these structures already also existed in Germany, where he's from, and so he knew that these women's heart clinic are really important. That's it's important work for the women, and also that it's an holistic way of seeing the women, also supporting them psychosomatic support and rehab support, etc., looking for hormones and all the stuff. And so I think we were really very lucky. We made a small concept, Eliza and me. We presented to him what is our plan, and that it's also including research and education. And I think he supported us right away. And then we were really like free to set up the clinic in the way we wanted. And for us, it was a very good start. Of course, it's a lot of work because if you start from zero, you have to design the letters, you have to look which secretary helps you planning in the patients, you have to write the research plans, get funding, and talk to the university how you can implement gender medicine and cardiology into the student lectures. And it's a lot of work, but it's also fun, gives you a lot of energy back if you see, okay, things are improving, things are going. So with this co-leadership, it's also like a perfect thing for us. I think it doesn't work with everybody, but with Eliza and me, it's absolutely perfect. From my side, I could recommend this to everybody to look for a partner in crime.
It's like your business wife.
Yeah, absolutely. Also you have to like each other on a personal level because you spend so much time with each other, more than your family probably, because if you work like full time, you see your family in the evenings and on the weekend. So in our case, it's really perfect and I don't want to miss this. And it's absolutely been great.
Yes. And it's also that what she says, you also, if you want or not, you will spend some time also in your free time working on
Yes.
it. If things have to be, there are deadlines that need met. Yeah, it is a fact. And then also when you're discouraged yourself or it takes time or you're overwhelmed with how much there's to be done, it's always good that someone says, no, come on, that you remind each other why you do this, and also that you say like, okay, let me take this, and you help each other out. I think that's also very
Yeah.
important.
Yeah, and
And
we don't count who's doing more work. We just look
we
for the
both
situation.
know.
When I know, okay, Elisa,
Yeah,
she has like a student lectures now for 4 hours this afternoon. If then there's something left, I can jump
yes,
in, and the other way around. So I think that's very important to offer your help and not to count like she did this and this so many hours for this. I did so
Yeah.
many hours. And
exactly.
I think that's the key of our success.
Yeah,
Offer help and support each other.
yeah. But yeah, you do get like, my daughter is like, is that Christine again on the phone?
That's true. But it is the we. And I think that that is also the collective good. I think when we go in sometimes our worlds and we just think about I and what I'm doing, it can, yeah, not be as productive. And to have someone else to partner with and to brainstorm with and to have ideas with and to celebrate in the successes with as well, because then you start to pull other people along with you.
Yes.
So it's the two of you, but what you're growing is
Yeah.
incredible.
She's more coming from the interventional side. I'm more coming from the non-invasive prevention side. So it's also like a good complementary thing. So the skills she has are addition to my skills, and that's also good because our profiles are not one-to-one the same. So that's also like I think very important. Yeah. Also from the personalities that like one person is perhaps like more representing this and this side, the other one like more the open side. And so I think that's really also for our patients, So sometimes they see me, sometimes they see her, and so they see different kind of personalities and different kind of views. Of course, we have the same thinking about the woman's heart health, but like the approaches are a little bit different. That's also nice. I think it's complementary. You don't have to be one-to-one the same exact personality to be a co-leader.
Yeah, no, not at all. Actually, the differences are what make it more powerful.
Mhm.
So, we've talked about that you're doing amazing things on education. You are also treating patients, which is crucial, but you're also doing research. So, Christina, can you just give us an idea about some of the research that you're doing?
Yes. So Elisa and me, we are very much interested in small vessel disease of women because the small vessel disease, so-called coronary microvascular dysfunction, has a high prevalence in women compared to men. And in our research, we want to explore the heart-brain interaction, the heart-brain connection, to see whether these small vessel disease is also reflected by brain abnormalities and also translating then in perhaps cognitive impairment, depression, and anxiety. So we're very much interested in that heart-brain link in small vessel disease in women.
Are you getting the support as well? Or do you feel that often met a VC yesterday and we were talking about investment in women-led research? Are you seeing any challenges in that, or are you getting the support and the funding that you need?
Yeah, of course, we have already gotten funding for our study, luckily. And I think if we explain the topic very well, why it's needed, why it has to be done, I think then also like some foundations are really interested and support us. They'll be very happy and very lucky. But of course, this has to be said on a broader basis. And I know that like many big studies currently are led by male teams, and also like the studies that form the guidelines are often led by male teams. And it's known if more women are authors in guideline-based papers, then also more questions on gender medicine will be answered, and also more other women will be included as authors. So I think there's still a lot to do, but in our project, we're very lucky that we already got some funding. But of course, to make it a bigger program, we even need more to, like the more funding we get, the more questions we can, of course, answer. But we have now a very good starting point, I would say.
So, Liza, we talked about some of the symptoms because it is so important that, again, you're doing educational programs for women. But if you were to summarize and look at some of the risk factors that women should be aware of, could you?
Yes, so hormones, estrogen play an important role in risks of women. So up to menopause, they protect us. And what women are often not aware of is as they enter menopause, the hormones that used to protect us then are gone. Your hormone level drops to before your puberty, different than in male hormones. They just really slightly and just go down a bit. In women, it's a big change in hormone levels. And that is also the moment where you get a higher risk for heart disease. So that's also the moment where, as a woman, you should definitely know what is my blood pressure, what's my cholesterol, what's my go to your GP and know your numbers and take good care of your health, of course. That is one big moment. Another thing is pregnancy. Pregnancy related high blood pressure, pregnancy related diabetes, those we know that relate to a higher cardiovascular risk in later in life. So if you had that, know that you can discuss this also with the doctor that you went to. And I think it's also important to have a good follow-up in those women. Also in your risk factors, they're checked out well. I think hormone shifts are a big thing. And another risk factor, which is more common in women, is autoimmune disease. We know that if you have an autoimmune disease, you're at high risk for cardiovascular disease, and that's good to keep that in mind. That's also why we like to cooperate with rheumatologists, for example. Yes.
Especially, I have to think back to when I was growing up. My mother was like, "We cannot take hormones because we're all going to get the study that everyone refers to," and that I think my mother's generation is very much still into to say, no, you can't take hormones because you're going to have issues with breast cancer. But actually, it's such an important thing to be aware of that hormones aren't necessarily the big taboo as what they used to be. And that we need to talk about that. We need to think about working and taking hormones. And that's why it's fantastic. Also, working with the gynecology department obviously makes a lot of
Absolutely.
sense that you're doing this holistic approach.
And it's very, very important that more research is done there, because there has been big studies but not performed very well. The studies that were done and which concluded that it could be dangerous were done in women that were 10 years past their menopause, that had already risk factors. What kind of risk profile do they have? Did they start very young in the menopause or not? Are they still in the window of the 10 years within starting menopause? All these add up to, is it beneficial for you, or could it harm you? It's very important to look at it with more nuance and not just say hormones are bad or hormones are good. No, it
Yeah.
really depends on your complaints, on the women, on your background, on your risk profile, and you have to take all of this into account. And we absolutely need more studies in this as well.
Yes, and we make a risk stratification in the women who have cardiovascular risk factors and who want to take hormones. There we
Yes.
have to look very in detail if they can take it, what kind of hormones they can take, transdermal, bioidentical, and etc. These are the newer hormones that are also not tested in these old studies where it's always referred to. But I agree with Eliza, we have to take a very differential look into the women. We cannot in general say you cannot or you should take hormones. It's an individual decision based on the cardiovascular risk profile.
And based on how much complaints also,
Yes, of
people
course.
Yeah.
forget that
Yeah.
it can be disabling, the amount
Mhm.
of complaints some women have. It can stop you from working normally, living a full, joyful life. So, yeah, you really have to take that into account too.
Yeah, absolutely. Again, this holistic approach, looking at everyone, taking time. We were talking about taking time a little while ago. And I have to think back, there's this, when we were growing up in school, we always heard you should spend the most time. If you want to cut down a tree, you need to spend the most time sharpening your axe. And then you'll be able to chop the tree down much more efficiently and faster. And I think it is, I just like to really reiterate that again, whether it is about, yesterday we were having discussions about protocols for clinical trials, how sometimes enough time isn't spent on those in the beginning to make a really excellent trial moving forward, and how much time can be saved and money can be saved if you spend the time on the protocol, get great endpoints, and really think about what you're doing in the clinical trial. It's with this too. It's spending time with patients in the beginning can have such a huge impact later. I think that's with so many things. We are at warp speed with everything that we do, but sometimes it's a really good thing just to stop and to breathe and to look and to really see people and to look at
Yes.
them as a full being and not just one symptom. And I think it's amazing that you're doing that, and that's what you're pushing also with the people that you're mentoring and the programs that you're putting together, the people that work for you, because that is going to have a ripple effect. This is called Be the Ripple podcast. You all are starting these ripples, and that's just such an incredible thing. So I'm so proud to have gotten to know you. I'm so pleased that
Thank
our
you.
journeys have crossed.
Thank you.
And This podcast has been about you, the research that you're doing, the work that you're doing, but it's also about two women working together and building something that is unusual, starting a department, working together, supporting each other for a greater good. And that is just can be such an inspiration to other women out there to do this. You don't have to take the typical route. You don't have to do, what we're told to do is how a department is run. You're setting, you're breaking and setting trends on how to do that. So thank you both for doing that. It's an incredible thing. But if you look forward, what do you hope for your department and where do you see yourself and the department growing?
So in general, I think in a gender medicine perspective, I would be very happy if these gender and sex differences are taken more into account in studies. Of course, we always have data like subgroup analysis looking on differences, but sometimes they're not powered to give us really results that could change any guidelines. So I would be very happy if these aspects are more taken into account, if studies are adequately powered to show what is better in women, what is better in men, what is better in other genders. So I think that's one basis, because if we don't have these data, we can also not recommend sex-specific treatment in cardiovascular medicine or also in other fields of medicine. So I think this is very important that this is taken into account. Then, of course, all the gender differences in cardiology, where we are aware of, we have to transfer this to the new generation of doctors, to the medical students, but also to the younger doctors. And that's what Eliza and me are also trying to do in our research group, in our department group, to transfer this knowledge, to show them the differences, to also show what kind of impact you can make in these women. So I think these are two factors that are very important.
I think it's very important that women cooperate more, that they see that that they can support each other, that they are not a threat of one another. They can go and have a beer or a glass of champagne or something.
Whatever they
But
want.
yeah, whatever they want. And that's why we organize also these dinners and these events, because I think it's a way thing. One thing is I think we should be supportive of each other and cheering each other on. That's one, otherwise we won't make a change. And that's one part. And the other part is that you do this together with the men in your surroundings in your department, because you need them as much as you need any woman who's supporting this topic. You won't make a change without them. You need to do this together. And and that's also what makes me hopeful, that I see these things, that I see that the women want to cooperate together, want to support each other, and that I see that we get great support from the men around us as well. And that's that's the change we hope to make.
Yeah, definitely.
Yeah, and I also think, like, on the one side, we want to improve the medical conditions in women with cardiovascular diseases. We want to improve healthcare, but we also want to improve careers for women in medicine and in science. And that's why we have planned a very big symposium in Basel on the 15th of December, the Women's Heart Symposium Basel, where we focus on both things. One, the medical side, where we have top speakers, international speakers, where we see like the medical side, including gynecology, endocrinology, neurology, etc. And on the other hand, we also have roundtables and discussions planned to see young women in clinics and science, like to give them role models, to show them what can be done to get a very good position, to be an author of a very important trial, like to cooperate, to spread your network. What are the tips young females and of course also male doctors and students can be given? And so I think it's a combination of both, and we're very happy also to see everybody who's interested in Basel in 15th December on our symposium.
Fantastic. Networking's the key thing, isn't it? And how to network well. Have you had to adjust how you network? Is that something that you've learned? Did it come natural for you? Because that's key in what you're doing, right? You need to build that network to grow all of this.
Yeah, I think we both knew that this was important, and we both did this before starting this Women Heart program. but it's been, I think, uh, exponentially increased. So we are very, very much aware of how important it is to have this network and to have connections and support. And we, again, also got advice from other women in this field, like Marta Golati, which is a pioneer also in the States, who set up this, who has a Women Heart Center, and also explained to us how important these networks are. And yeah, that's also what we try to teach the next generation, that it is very important,
It is.
as important as every other part that we do, as the research, as the teaching. Is important to build a solid network of supporters
We
and
need each other.
also critical people, because we need those people as well. We need also to have critical people to, because that will teach us what's wrong and how we can improve ourselves.
And we are also kind of overwhelmed to get that we got to know all this big network of women fighting for the same thing, for equal care, and also from HBA side, and so many people, and like foundations and circles and like groups we know now. So that's really nice to see that we can connect with them, so that our message is spreading. That's just really wonderful to see. I would not have expected this, that from so many sides women are coming, and also males are coming to support this topic, to close the gender gap. So yeah, so we're very happy about this.
For me personally, is very important. It's not just by closing the gender gap. It's not just about women. It's also about men, in the sense that we know, for example, that men suffer from depressions in a very different way. And I believe if there was a program specifically for men to deal with this, so they get better treatment, then I would fully support this. It's not about men or women, it's about getting the same outcomes, being recognized when you have different complaints, recognizing your own complaints, that it's just is more equal, I would say. I
Yeah.
think that's important.
Yes.
So I would celebrate any initiative where, if it's in the disadvantage to men, that they would get like more research and a special program in this done too, or more support. I would absolutely. So it's not just for me, just of course, it's part of the program is women empowerment. Of course, that's, but on the other hand, we just want good care for
That's what we want for
all.
everyone.
And yeah,
So true. Well, thank you for bringing better care and raising awareness and teaching and research and everything that you're doing. I'm so happy that our paths crossed. I'm happy that they're continuing. There's so much to do. And you're right, we all have to do it together. So thank you both for the incredible work that you're doing. And yeah,
Yeah,
look forward to seeing you soon.
thank you. Thank you
thank
for
you, Gib, for
having
giving us
us.
the platform also to present
Absolutely.
our ideas and our message. So thank you very much from our
Yeah.
side.